I'm Professor Klaus Rabe, pulmonologist, but trained as an internist. I am a senior professor at the University of Kiel, which is in the northern part of Germany, and my clinical base is in Hamburg. I just visited Shanghai a few weeks ago to a large meeting, and I say hello to all the colleagues that I've met there and the ones that are hopefully, will be meeting in the future. Thank you very much. Well, it is true. I've been to many of the meetings of the American Thoracic Society. Someone coming from Europe. We have also a large meeting, obviously, this year in Barcelona. And I guess we have times where people have to really consider whether they go to a meeting such as this one. There are prices involved. We have crises in this world. So that influences also a scientific community to some extent. I mean, there's no question about this. But, we as doctors and researchers, we go to these meetings as a hub, as a networking place between colleagues and friends. And I've met at this meeting here in Orlando very, very many friends and people that I've been working with over the years. So it is a very enjoyable event to come, and it is rather essential to have these meetings to support science and to develop sort of clinical improvements for our patients with chronic lung diseases. You see, there's always a great emphasis on new medicines and new trials. And there's a whole number of clinical trials that have been presented here. So there's progress been made in interstitial lung diseases. We have a new drug that bears promise to change outcome in these individuals. I've seen, for example, a very interesting presentation today also about interstitial lung diseases in children. It's a rare disease, but this is, where a lot of research is going into. We have obviously the large trials on asthma and COPD, and there we have new drugs. We have so-called biologics, and this market is developing rapidly. Some years ago, it was very much emphasis on asthma medication, new asthma medications. But as you probably know, the area has moved on a lot in COPD as well. And we've seen very interesting trials to be delivered here at this Congress. Some of them about drugs that will still be having to be developed. Some of them that will see the day of clinical light very soon. There's things that we do is related to inflammation in the airways. And I'm personally, and my team is involved in drug development. One emphasis is around alarmins, a new group of cytokines that are involved in the pathogenesis of COPD. We've presented a clinical trial here, and we've also been involved in mechanistic studies to take biopsies from lungs to understand how these drugs work and how we develop further targets for new drug developments. Further, the ATS is having a meeting before the clinical program, which is the RIS, it's the Respiratory Innovation Summit. And that presents new data from science, from biotechnology, and there we're also very active in trying to find out new modalities, new treatments for diseases such as fibrosis and inflammation. So we have been very active here. We had several posters here, and it's the young individuals in the future that will have to drive progress in these research agendas. When I say there's a lot of progress, there obviously are remaining issues. One of them, even though it's not really an emphasis of the ATS meeting, there are other meetings, it's lung cancer, still being a major challenge. And so unnecessarily, because the risk factors, at least for most parts of the world, with cigarette smoking are known, and you would wonder why you cannot do more about this. Secondly, I think we need to be understanding that most of the chronic diseases, such as COPD, that we diagnose very late. So there's now a lot of attempts are needed to identify people at risk, patients at risk, to intervene early and to change the slope of this. And thirdly, we are a pulmonary community, but chronic diseases, again, such as COPD, but also severe asthma, are diseases that are associated with other morbidities. So we need to talk to cardiologists, we need to talk to endocrinologists, we need to talk about specialists in the upper airways as well, to actually come up with good clinical algorithms to further help guidelines to be developed. But I think the early detection of risk populations, I think that's one of the major challenges that we're facing.